All right, everyone. It's about 10 o'clock, so why don't we go ahead and get started? And we're super excited to kind of wrap up our webinar series. So this is officially our last episode. So thanks everyone for joining. My name is Tanya White, and I'm a design researcher with Hugo, which is Corgan's research and innovation arm. And so today, to kind of wrap up the series, we're going to be talking about this new focus on health and how the pandemic has kind of brought to the surface how important our physical and our mental health is within the spaces that we occupy, and how we can kind of help facilitate in that process as architects and designers. And so we're really excited to get this conversation started today, but we want to make sure we can introduce everyone who's so graciously gifted their time to be here. So why don't we start off with Alejandro? We're really excited to have you here today.
Thank you, Tanya, and welcome everybody to this webinar. I'm Alejandro Ibanez. I'm a design manager in Corgan, New York, in the aviation sector. And, if I were to talk a little bit about the way I work, I like to tend to look at projects with fresh eyes and curiosity. That means sometimes like challenging the standard and trying to optimize processes. So right now, I would say that is one of those times, challenging times, that is really a good time for opportunity to really research, innovate, find those solutions that are out there and start collaborating between different sectors and colleagues, trying to get everything better. So excited about the future.
Absolutely. Well, thank you so much. Okay, we also have Corey. How are you doing? We're excited to have you here.
Hey, Tanya, thanks. I'm Corey Deere, and I'm the design director here in the Dallas studio for both commercial and data centers. And just to describe a little bit of what's on my mind right now, at least, really thinking a lot about our new priorities, just coming out of the COVID crisis, and then also thinking about our shared memory of working from home and how those two things together are going to really heavily influence our coming back to the office and really our mindset in doing so. And so I think this is just a really good opportunity to take this moment in time and really reimagine what the workplace can be. And instead of saying, how can we make the workplace safe? Let's make sure we also focus on, how are we going to make people really want to come back and enjoy their time back?
Absolutely. Those are some really interesting concepts, and I hope we get to discuss them today. All right. We also have Stacey. We're so happy to have you here.
I'm Stacey Brimmer, and I'm a design manager in the healthcare studio out of our Dallas location. And one of the things I've always loved about architecture and design is its ability to foster connection between people and the spaces they're in, and then people to people. And I think right now is an especially important time to reinvigorate that sense of connection. So I'm excited.
Absolutely. Absolutely. Well, thank you so much. Okay, we've got Robbie. Thank you for joining us today.
Thank you. Thank you for having me. Robbie Good. I'm with the Brandon Environments group at Corgan in Dallas. And I was really driven to design by passion for creative problem solving. And I think one of the bright sides of the pandemic is that it's afforded a wealth of opportunities for creative problem solving and, to Alejandro's point, collaboration between different groups across the world. And it's sort of an exciting time to be a designer.
Yeah, and for the COVID-19 best practices report that we did as a firm, there was a lot of kind of cross collaboration. We were also lucky enough to work with some external partners. One who has been able to join us here today, we have Pete Jefferson from Branch Pattern. Thank you so much. Why don't you tell us a little about yourself and kind of your outlook on design and the research we've done?
Sure, and thanks for having me. So again, Pete Jefferson with Branch Pattern. I'm a principal there, but also manage our building science practice, which is a multidisciplinary group of architects, engineers, and scientists. And at the core of our mission is to really create spaces that work for both people and the planet. I think the current situation, if there is a silver lining, is that it's elevating the conversation around building health. And we have lots of great evidence that buildings that work for people tend to also work well for the environment. So my hope is that we emerge from this with that greater perspective and understanding that allows us to do both really well.
Great. Well, we'll definitely get to talk about all of these incredible topics that you guys have brought up. So why don't we just kind of get started? I think one of the things that this pandemic has really brought to the surface is our acute awareness of cleanliness, and it's almost become a hyper cleanliness where, you know, things like Clorox wipes and Lysol spray, you can't even find them in the stores anymore, and that we are suddenly just very aware of physical health and all the surfaces that we touch. And I was interested in just getting some perspective on how that's maybe impacting our perception of space and how we have been incorporating cleanliness and sanitization into design. And I think to start us off, Stacey, you've been in the healthcare sphere for a while where this has always been forefront, and now other industries are kind of incorporating it in new ways. But your perspective would just be great to hear about, you know, this kind of hyper cleanliness and how we can see through the fog of lots of options and products.
So I think the first thing to start off with is really understanding what you're dealing with, right? There is a broad range of types of infectious diseases that you can deal with. There's bacterial and fungi that fall in kind of a microorganism category, and then there is viruses, which some scientists do not group together. And the reason is bacteria and fungi can reproduce, which is really the key, outside of a host. So they can reproduce themselves on any type of surface. But a virus requires a host, a living host, in order to reproduce. So the things that will work for a bacteria or other microorganism don't necessarily work for a virus, right? They might, but they don't. And I think one of the challenges that we've had, similar to when sustainability was kind of first coming to be commonplace, there was a lot of things like greenwashing, right? We've had a lot of anti-washing right now. Everything is touting how it's antibacterial or antimicrobial. But the problem is COVID-19 is not a bacteria. It's not a microorganism like that. So really understanding what you're dealing with is the first step. The next one is to understand that there is a difference between cleaning and disinfecting. So cleaning is removing the dirt and grime and daily buildup that happens, but disinfection happens after cleaning. And that's when you are killing the bacteria or the virus that is on the surface, right? So they go hand in hand. You can't have one really without the other one. And that segues into then your material selections, right? So there's a difference between materials that are easily cleanable and those that are self-cleaning. There's a lot of really interesting, easily cleanable products on the market, and they use things like biomimicry, which is looking at natural properties in order to make them more cleanable, like the lotus leaf and hygroscopic and all kinds of different nano surfaces. And then there's those that are self-cleaning. And these are a lot of the ones right now that are being put out there as antimicrobial surfaces, right? The challenge is that a lot of these are self-cleaning or antibacterial because they contain heavy metals or other products like that. And heavy metals are not part of a human body, right? So we just don't know how that affects our health. The Center for Disease Control actually recommends not using those products because not only do we not know the impact on the human body itself, but they can also facilitate the creation of superbugs, similar to like the antibiotics trend, and trying not to do that too much. So it's really, really important to understand that and also balance it with the fact that most disinfectants they're actually registered with the EPA as pesticides, right? Because they are designed to kill living organisms, but we are also living organisms. And so you want to make sure that you're not doing more harm than good when you're trying to deal with these situations.
Yeah, right. You don't want to create other blind spots in its path. And kind of in that same thought, we want to make sure that we don't create these environments that are so sterile and kind of unwelcoming. And so how can we continue to design spaces that are, one, healthy and safe, but also kind of warm and welcoming and human-centered, right? Because we are living things in the built environment. And I think, Robbie, it would be great if you could chime in, like, with your perspective from the branded environment, and your thoughts would be great.
Sure. So one of the things I think a lot of people probably noticing as they get back into environments outside of their home is that there's a lot of instructional signage. There's a lot of just rules and regulations that you see being posted all over the place, and it's not the most warm introduction to a space, but these signs are important to make visitors feel safer. But these are also temporary things. So I think if we're talking more long term and looking at how we're creating welcoming spaces in the future, I think it's important to think through how a space is speaking to somebody with or without words. So I think there's an opportunity right now to sort of literally take a step back and look at larger design gestures and components that will create warmth and welcoming experiences without necessarily requiring we be in close quarters.
Yeah, and Robbie, I just kind of want to think about that a little bit, and also go back to what Stacey was really trying to guard against with some of her thoughts about really an overreaction. And so I'm kind of concerned about materiality in buildings. And I think that we're all pretty aware of materiality when we enter a space. So if you think of maybe an airport with, when you're surrounded by terrazzo and stainless steel everywhere, or maybe some of the clinical spaces that we find ourselves in, those aren't always the most welcoming and warm environments, and for good reason. There's a reason why the material selections are the way they are, and they have to do with maintenance and cleanability, as Stacey was mentioning. And what I just want to make sure of is that attitude of kind of overreaction doesn't trickle into other environments, which I think pre-COVID were more leaning towards, I think, in an era of authenticity and softness and warmness. Just thinking about the hospitality environment and that coming into the workplace, and just also thinking about working from home and what people are going to remember coming back to the office. So we don't want them to come back into a place that feels a bit inhuman, if you will.
Yeah, we definitely don't want to get rid of the 50 years of human-centered design we have worked so hard towards just because of this event.
Right.
Yeah, absolutely. And it's so important that we rely on all sorts of research and data, and qualitative human-centered design being one of those. Okay, so let's talk a little bit about technology, right? Because we've seen this emergence or even renaissance of existing technologies being incorporated to help us kind of battle this virus. And we're seeing some really interesting applications of it in the built environment. So for example, some Amazon logistic facilities are using machine learning to teach their computer vision systems to track and monitor if employees are maintaining 6-foot distance between each other. They're also using thermal cameras to check employee temperatures as they come on site. We're hearing about robotics helping kind of clean and sanitize in ICUs to limit the exposure that healthcare workers are already experiencing. And these technologies are not just limited to the physical machinery. They also include these systems and processes that kind of have to be put into place to manage people, and especially large crowds and volumes of people. And so I'm curious to learn a little bit about the technologies and sanitization processes that architects and designers are considering, and then how do we kind of assess their business viability, right? Because there has to be an investment and a return. And I think, Alejandro, your background in aviation would be a great place to start because it is known for accommodating large crowds of people. So it's kind of a sticky problem. So would love your perspective.
Yeah, thank you, Tanya. And actually, I would like to highlight that second question that you throw out there. It's going to be very critical to evaluate all this technology that we know is out there. Like I said before, we have a lot of technology that we know it can help us, right, to improve the health in the spaces, not only in aviation, but other industries too. But we're going to have to partner with, in my case, airport leaders, clients, engineers, to really select what are those that the cost versus the real impact or benefit that we're going to get in each project context. So that's going to be very important. Now, circling back into the technologies, I like to think in two realms, right? We're going to have the building systems that you said, and then we're going to have the management of people, the management of the user, the processes that we have for example, in the airports. In terms of, for example, mechanical systems, we're going to start listening a lot about natural ventilation, about bringing that outside air and mixing it with the return air or the indoor air that we have in our HVAC system, right? So that standard is going to go higher. We're going to be looking at higher standards on air filtration too, right? Right now, there's institutions that they're talking about MERV 13 filters as the minimum of higher to really filter that kind of tiny microbes that you have in the air, right? And this is similar to these N95 mask that we're seeing, like an analogy to that. And humidity is going to be, let's say, enforced, 40 to 60% at humidity radius that we know they really benefit the health, but also it reduces the spread of virus, or it doesn't help to go wild when we have one of these situations. And then the one that technology that I would like to really dig in a little bit more, and that we're seeing a lot right now, is ultraviolet lighting. We have UVA, UVB, those are the ultraviolet light that reach the earth. We get sunburn and red when we go to the beach. Now the UVC light is the one that really is effective against viruses, right? So it's also harmful, and we're gonna see this technology on unoccupied spaces or units, right? Compartments. And right now, that technology has been used for decades in the food industry. It has been used in hospitals. But we're looking now, for example, in my sector, seeing ultraviolet lighting, for example, in escalators, right? To sanitize the high-touch surfaces or moving walks. We're seeing these implemented in scanners. When you go through security, the trays where you put your luggage, those are highly touched surfaces as opposed to your personal luggage. So we're starting to see how companies are starting to grab these different technologies out there and implement it in, for example, in our sector. And then jumping into the passenger and processing of people, we know that we want to avoid crowds, we want to avoid long lines, and we want to provide touchless processes. So we're going to start seeing a lot of facial recognition, right? These are technologies, again, I want to emphasize, that are out there, but there was not really an event, or there wasn't a situation where it make this to be mass produced or mass utilized. So I think it's a moment to really look at what we have and really use all these technologies out there to really implement them in our projects.
Yeah, and I think in order to implement those technologies, there's almost a setting of the stage that we have to do. We've consulted with a number of people about some of these technologies, and the thing that we sort of knew going into it that I think will be a surprise to a lot of people is that the existing systems that a lot of buildings and facilities managers have aren't working the way they're supposed to. So even before we can get to some of these upgrades, a lot of what has to happen is shoring up those systems through things like retro commissioning. Even some of the super spreader events, when you look back at those, some of the things that are cited are like inadequate ventilation or ventilation not up to code. Well, I hate to say it, but that's far more common than what most people realize. So before we can even get to the stage of implementing some of these things, a lot of work has to go into just getting things working the way they're supposed to. But once you do start to implement those technologies, how do we avoid just reverting back to that previous case where things stop working again? That's where I think some of the technology comes into play with remote facilities management and remote indoor air quality monitoring. So more and more, we're deploying hardware and software that allows us to remotely view how the building's performing, set up faults and diagnostics that will then inform us if there is an issue and what that is. Specifically with air quality, there's no sensor that I'm aware of that detects COVID-19. So we have to look at things as proxies for it. So if we've gone through this effort to increase ventilation, for example, well, if we're CO2 levels in a space, it might be indicative that the ventilation system's not happening. So a big part of where we can leverage the technology is to give us more real-time feedback on building performance and let us know that if we're going to invest in some of these upgrades, that they continue to work after they've been installed.
That's a really good point, Pete. And if I circle back to what I was talking about, technologies, I didn't mention health screening, but this is an example of a technology that it was really implemented in a different situation, but it has some analogies to today. In 2003, we had the SARS problem, and Canada invested a lot of their resources into providing this screening system through all the airports, right? Trying to avoid having one sick person going through their borders. But the reality is that they found that sick passengers went through the screening process, right? And there was a spread of the virus over there in that country. So IATA actually, in the case of airports, they recognize that health screening is not really going to be a problem solver of everything. We know coronavirus, there's a lot of people that are sick but doesn't show symptoms. But it can mean like, you're going to have a deterrent for sick people to really go to airports, for example, right? They will be kind of concerned of being discovered, right? That they're sick. Or you'll have reassurance measures that you have in the airport, so people will be feeling safer because they know that things are happening. So again, it's going to be more a compound, an analysis of all the technologies we have there, and then choose which one really work, the combination that really work for the client and the project.
Yeah.
And I think just one last important factor in that is taking into consideration the branding perspective of some of these technologies. And if you're thinking through costs, one of the low cost interventions is like these removable self-cleaning surfaces. But some of those you're going to see a lot of their own branding on, and a lot of just extra visual clutter. And so I think it's still important to think about how to use those technologies and still make it feel like your own space.
Yeah, that's really important. And what I am hearing in the conversation right now is like the technologies don't exist in a vacuum. They exist in tandem with humans who have all sorts of behaviors that can be pretty difficult to predict and then understand. And so especially in a really disruptive event like a pandemic, we're trying to figure out of these behaviors, which are temporary or reactionary versus which ones are going to have long-lasting impact on how we kind of behave and conduct ourselves. And so it's going to be really hard to determine that. And so as we're in the middle of this through the fog, how can we incorporate our understanding of human behavior to create healthy spaces? And I think, Stacey, you've had some really interesting thoughts about how we can do that.
So this takes me back to, there's a diagram that the Center for Disease Control put out. And, when you're a healthcare designer, that's part of the space that you live in. But it has the action items listed from most effective to least effective. And PPE, which is personal protective equipment, are masks and gloves and things like that. And then administrative controls, which is where you're trying to change people's behavior and how they work. Those are some of the least effective things that we can do, just because human behavior is so unpredictable. And I think that what we are focusing on really in this conversation, and I'm excited about, is looking more at eliminating either removing or replacing the hazard, which are certainly more effective controls to actually get this thing stem the tide.
Yeah, and when Stacey first shared this graphic with me, I felt like there was a real parallel with the early days of sustainability, particularly around energy efficiency, and the old adage of reducing temperatures in the buildings and then asking people to wear sweaters didn't work. It wasn't sustainable in the long term. And so at its core, human-centered design is really about having empathy and understanding people's needs. So I think that's the situation we're in. And Tanya, I would just add, you made a comment about interconnectedness that reminds me of something that we say a lot in the building science industry, which is buildings are a system and people are part of that system. So we're all connected, and really we have to understand how people are going to behave and then design for that type of response.
Yeah, and I think it's nice that you're focusing on human needs and kind of natural behaviors. One of the things I think we're thinking about a lot right now, and a lot of our clients are reaching out to us for our opinions on this, and it feels like there are really simultaneous human needs happening right now. And I mentioned it a little bit before, but around COVID, but then there's also needs around working from home. And so I think that we really need to thoughtfully address both of those simultaneously to really reach towards, I think, a built environment for the future that we can be really proud of. And I feel like, with COVID, there's a spatial need, a need for us to be separated from one another physically. And then I think if you imagine, working from home and the privacy that you had in your own home versus going back to an open office and trying to get on a call like this where, you're sharing information with people remotely, there's going to be an auditory component to that, and not wanting to, frustrate your neighbors essentially. And so I think there's going to be a real estate balancing act where we're potentially giving people a bit more private space and maybe reducing a bit of their communal space, knowing that this is the new communal space. Not that it would ever, totally mow over the communal space that we have together physically, but I think there is a bit of a trade-off. And then one more just kind of aside is, thinking about norms of the workplace versus norms at home. How many of us do enjoy using the restroom, with the rest of our workers? And I think that there are some things like, for example, personal restrooms that we might begin to see filter in to office and other environments due to both of these factors combined together.
That's really interesting. And kind of continuing this conversation around the human behaviors, we wanted to make sure that we could discuss a design sprint that we participated in as part of this COVID-19 research that talks about hand washing. So everyone is, becoming very familiar. I sing happy birthday for 20 seconds while I wash my hands. And so as part of this research, we wanted to better understand that behavior. And so, like I said, we participated in this design sprint. And Robbie, you were part of this. And I would love if you could just share a little bit about the book that was developed, the concept, and I'll make sure to show an image while you discuss it.
Sure. So as part of this design competition that was based in the UK, we developed a product called Para, which is basically a hand sanitizing wearable. So about the size of a wristwatch, like you see on the screen, but it would have a kind of a touchless interface so that, it'd be gesture activated to actually spray a small amount of sanitizer, which would be refilled from stations that would, theoretically be pervasive around public spaces. But part of what we considered in this was just, human behavior. How do we create something that's really easy to use? And what other factors can we consider? And one of those factors was that actually hand washing with soap and water, has always, been known to be more effective than hand sanitizer. So we were thinking, how do we include something in this that would relate to hand washing? So we came up with this idea of a timer which is represented by the circles that you see kind of going around the face of the design. And interestingly enough, this week Apple announced that the Apple Watch is now going to have a feature that automatically senses hand washing and starts a 20-second timer. So we think they were listening in.
They must have Zoom bombed our work calls. Yeah, okay, so these wearables that are kind of been emerging for the last few years, they do kind of tied into this next question about data and how we can be data driven and how we collect data. And wearables like this, you know, they're great at kind of influencing our behavior, but they also collect a lot of really valuable information that we can use to better understand. And so as part of our COVID research, we also wanted to look back in history a little bit to see how data has been used in the past. And one of the first examples that you really see of this is in the 1850s during the cholera outbreak in London. There was a physician who was kind of determined to figure out what was going on, because at that time they thought cholera was spread through bad air. And so he went in and conducted a series of in-depth interviews with community members in the neighborhood where they were just seeing lots of outbreaks. And he was able to track the outbreak to a contaminated public water pump because he mapped out the cases. And so this becomes the first demonstration that links cholera to contaminated drinking water, but it also is one of the first examples where we see data visualization, right? It's not maybe digital in the way that we experience today, but it definitely reinforces how important it is to consider data when we're designing. And so out of that case study, you see things like sanitation measures kind of scaling up, rezoning the way residences are built to allow for more space between residents. And so his work is just, his name is Jon Snow, not from the Game of Thrones, but his work is just kind of seen as a pioneer in this step of data visualization. And so I wanted to hear a little bit about how we as designers are using data to support our decisions and kind of the challenges that come up, because data collection is also a little controversial, but it really can help us better understand what's going on. And I think, Alejandro, there are some pretty interesting systems taking place right now in aviation just to manage these large crowds, and it would be great to hear from you.
Yeah, actually, that's a really good question for the aviation sector. We as designers, to design our facilities, look at multiple inputs and multiple data, right? We're looking at passenger flows, passenger loads, distance from point to point, different processes that happen throughout the terminal. In mechanical system, we're looking at temperature, air filtration, humidity, airflow rates. So all these different data that we collect constantly really have an impact on the journey of the passenger, on the employee itself too, and at the end is on the overall wellness of the facility. And now also with the new technologies that are out there, we also know that we can collect information from profiles of the user or the passenger. Even though this is a little bit controversial, it really can have a good impact on both the passenger and the airport. And with all this information that we gather, and this can be gathered through sensor, through applications, through cameras, the reality is that we can improve, let's say when you go through security, right? We want to avoid people spending time on queuing lines. So you're going to be, what if you could identify the passenger that can go through those lines quicker versus other groups of people? And a quick example would be like the lonely traveler or the business traveler, frequent traveler, that can, we know he can go right really quick through those lines, instead of like the family or that's people that travel less often or with more luggage. So kind of trying to speed up those processes. The same with check-in and other processes. Right now we're seeing that we can check in at home, we could tag our luggage at home and go to the terminal, drop these luggage, and then continue. So the reality is what we want to avoid is having passengers spending time in these queuing, crowding areas, and having them like more dispersed throughout the terminal with all the new amenities, the new retail that we are doing in the new concept of airports, right? We are creating welcoming gates. So that would avoid the stress, and that would really also, at the end, will impact in the revenue of airports too, right? Mm-hmm. So really very important is how do we collect data, but even more important, how do we analyze it, and how do we respond as architects? And I'm happy to say actually that in Corgan, we released a few weeks ago the Airports That report. I really encourage everybody to go into our website and download, because it really filters all this information that we're talking about through three main subjects. One is social distancing, which can be measured that are more like temporary, touchless processes, incorporating technology that can be more permanent, and then ultimately wellness, which is the topic that we are discussing here today. So it really very critical, going back to the beginning of the question, identifying these solutions that are temporary for dynamic situations, which ones are going to be permanent and really benefit the terminal or the built environment, and ultimately which ones fit the project context and our clients' requirements.
And I think from our standpoint, being a building science practice, a big part of data for us is the existing research and current research that's coming out around what creates a healthy building environment. So if we rewind a few months, I think like everybody else, we were trying to get a grasp on where is the existing evidence and what does it point us towards. Alejandro hit on some of those topics earlier, talking about humidity, ventilation, filtration, and UV. Those are some classic go-to things for reducing viral transmission. So we fortunately have an R&D team in our practice, and we were tasked with looking into this. And essentially, we're doing a parallel effort to what groups like ASHRAE were doing with their epidemic task force. And I'm happy to say that we ended up with similar sorts of conclusions from the review of the research. But I think we also realized really early on that what ASHRAE was coming out with were suggestions basically of consider increasing filtration, consider increasing outside air. But we're going to be in this situation where we have to make decisions between some of these technologies or try to apply them to systems that may or may not be compatible with them. So we started a couple months ago to develop a tool, and we actually just released it this week, called a flu infection risk estimator that is on our website. And we've released it to the public. We knew we would use it a lot internally, but we felt like there was this public good if we were able to release this and encourage other designers and facilities managers to use it as well. So what it essentially allows you to do is change the parameters of your space and different technological solutions to reducing viral transmission. So right now, unfortunately, the research is really around influenza A that exists. We are getting new information around COVID-19 daily, but we've constructed this in a way that as we get that information, we'll be able to go in and change parameters as well, including changing the virus that's being modeled or studied from influenza A to COVID-19. We're looking at some of the things like PPE, including that in the parameters that can be changed. So this is a tool, version 1.0, it says right here. I think it's got a lot of utility as it stands right now, but we hope to continue to evolve it and update it with new data and research that emerges.
Well, congratulations. I'm sure that's been a lot of work, and we can't wait to see it in action, and we'll make sure to include a link to this tool when we follow up with everyone at the end of this webinar. So we're starting to wrap up, and we wanted to make sure that we allotted some time to talk about different types of health, right? So we spent a lot of the conversation today talking about our physical health, because COVID-19 and as well as other virus and bacteria, they affect our physical bodies. But the pandemic has also highlighted how crucial it is and important to address mental health. The pandemic has created this almost wake of destruction in its path from overwhelmed hospital systems, traumatized workers who are kind of putting their lives on the line. We're seeing unprecedented rates of unemployment, and with that, financial insecurity. And we're also seeing communities are confronting racial injustice that have kind of hit a tipping point. And so there are just these high rates of stress anxiety and depression within our communities right now. And to put that into perspective, there is a federal emergency hotline for people who are in distress that has registered a more than 1,000% increase in the last few months compared to the same time last year. And so we are, not only addressing the physical health during the pandemic, but also this like entire ecosystem of people that are experiencing the mental health impact of this. And so when we say the entire ecosystem, we're looking at a model like healthcare, right? Where the healthcare workers are experiencing a lot of stress. They're facing death and sickness every day, but patients who are sick and dying are also experiencing stress. And so it's really important that we understand kind of all of the end users in these spaces and how we can design spaces that address and alleviate mental health. And Corey, I would love to get your perspective on this and how we can do it within the workplace.
Sure. So in the workplace, obviously, the office employee is the end user. And so taking care of their mental state is obviously really important. And I think what we're beginning to focus on more and more these days is thinking about their mental state throughout the day. And so just to give a couple examples of that, we're really looking to tap into the outside environment in a couple of different ways that we'll show in a second. So in this project that we're about to put on the screen, this is for the American Airlines Credit Union. And we wanted the employees to come to campus and feel like they're constantly connected to the outdoors. It's sited near an existing creek. And so whenever an employee comes with their bike, they go to a bike rack that's actually fully sheltered from the overhanging space above. And they get from first introduction to the office, they get a sense that they're surrounded by nature. And that creek is something that they can look out on from the balconies that we also have surrounding the rest of the building. And so the other image there that shows a woman taking a phone call off of one of our balconies, that's actually an opportunity that we provided per floor. Many buildings have outdoor amenities, and at times those are shared in one common zone. So for example, if it's up on a roof deck, that means that you get into an elevator, you go up there, and there's this pressure to use that as a destination. But I think when you give people the opportunity on their floor where you actually are able to just to get up from your desk and go out very easy and in a very easy and convenient manner, I think it really highly encourages those moments where you can just take a nice breath of fresh air and just kind of calm yourself down if you're having a stressful day. So those are just really two examples on one project, but I think that type of thinking is beginning to surround a lot of the decisions that we're doing right now.
Yeah, and to that point, Corey, I mean, I think obviously the shape of the physical space is going to be one of the most critical factors in increasing mental health. But there's also, verbal and communication tools. I think wayfinding is going to be one of the key factors that helps reduce anxiety. I mean, there's all kinds of studies about wayfinding, particularly in healthcare environments, and how that reduces stress for visitors, particularly families that are under a lot of stress. But now this also includes like all the instructional signage related to social distancing that we're seeing in buildings, and we've put a lot of research into the actual language that's being used in those signage components so that they can help reduce anxiety.
Yeah, I would like to add something. I think, as Stacey mentioned before, the number one thing in this situation is cleaning less and disinfection. But if we want to transmit that or convey that to the user, we really need to show that, right? We need to increase that perception of that cleanliness in the space. So that's the way to reassure passengers or the user, right? On the workplace, on the education sector, in every built environment, it's going to be perhaps providing that type of interaction, right, with the operations. And I'm going to throw a quick example out there. Think of the QR codes. If you had those in the restrooms or throughout the space, right, and you can like really scan with your phone and send some feedback. to the team of the facility. So those things, as we were saying before, science and that technology being displayed and being used right in the different buildings is going to really reassure the people that we are entering into a safer space, and you're going to reduce the stress, also with reducing crowds, reducing lines, right? So all that is going to really help on providing mental health, let's say.
Yeah, absolutely. And that was a bit of a loaded question too, right? It's a big issue and thing, and we can kind of tackle it from lots of different mechanisms, and also kind of personalizing these, because what works in an airport is not necessarily what you want to do in an office space.
Yeah, and sorry to interrupt you, Tanya, sorry to interrupt, but the reality is that one of the things that, because I didn't mention, and I wanted to mention, one of the things that we could use is having a plan, right? So before, maybe I didn't make it clear, similar to what the hospitals have, like having like a plan where you identify different threats, different levels of a situation that can occur, but then you have that response readily available. That's going to be critical. I wanted to add that, and actually that we in Corgan, we are creating that, and will be released very soon.
And we kind of talked about that in one of our other webinars in this series, that in terms of building trust and relationships with clients, and that preparedness planning can be very collaborative, so that everyone's on the same page when something like this does happen. So we are wrapping up our webinar. I can't believe the time just kind of flies. But I think to kind of wrap this up, one of the most interesting things has been seeing these creative solutions that are kind of being born out of this crisis. And so whether they are brand new solutions that we've never seen before, or we are kind of looking into the past to see what we can kind of bring back, maybe with some tweaks here or there, I would love to hear some of y'all's thoughts about like maybe some of your favorite creative solutions that you've seen, or ones that you think hold a lot of promise. And Corey, I would like to start with you, because when you were talking earlier about the outdoor space, I thought that was just a really interesting concept, and kind of reclaiming the outdoors. It'd be great to hear from you.
Yeah, sure. So I think it's kind of a reconception of office space, to just hone in on that again. I feel like, back in the 70s and 80s in particular, the office space was really a vessel that was meant to kind of hermetically seal us from the outdoors. It was protecting us from the wind and the sun that was assailing us. And I think now, and especially if you think pre-COVID, there was much more of this understanding that, going out, staying in an Airbnb, going to a place you've never been before, venturing out was actually a really important thing. Traveling was hyper important. And many times some of our favorite memories from travel is when we're outside. And so I think, making the workplace more special, I think has a lot to do with getting us back into touch with those kind of feelings. And, I think the new concept is a lot more porosity in buildings and bringing the outside in much more. So it's much more about getting out than just kind of getting sealed within a container. And, you're mentioning creative solutions. And I think one of the things we need to start doing more of is remembering some of the solutions of the past, whether it's, it could be something like the mid-century roadside motel. I know that doesn't conjure all the time like amazingly positive connotations, but one of the things that's great about it is how you circulate and how you're in the outdoors and you enter the unit from the outdoors, and all the circulation is external. Very similar, but a completely different type of building is the Cloistered Courtyard, something you'd see in a monastery or something. And that could be hundreds and hundreds of years old. But again, it's this idea that you're constantly moving around something that's really enjoyable in the outdoors. So I think there are patterns that are currently established that we might just need to reconnect with, and just question the double-loaded corridor, for example. Is that really the best way to move through space? So it's just taking those opportunities, big and small, and just trying to reimagine, what kind of spaces we'd like to see.
Yeah, I think one of the more interesting things that's happening right now is that we're seeing, not just buildings but entire cities sort of changing. And you see cities that are reclaiming streets and creating more pedestrian zones, adding parklets, and cafes that are adding more outdoor dining just to accommodate more social distancing. And what you see overall is more communal space, more pedestrian space, and space for active recreation, exercise that's become so critical at this juncture in time. And I think what we're seeing is that, like, anytime we have a global event like this, the world is going to come out looking a little different.
Yeah, I think from my perspective, one of the things that I'm maybe excited for in this is this increased platform that we all now have to talk about healthy building environments. It was a challenge in the past. I think a lot of times the normal mode of thinking was that we just get that in normal buildings, and I think people are becoming more attuned to that not being the case. I'm still an energy geek at heart. I'm an engineer by training, so I want to see low energy buildings, and I felt for a long time that the pathway to low energy buildings was creating great spaces for people. It's so much easier to have that conversation now and to show why things like thermal comfort, that things that are really important for people, also yield these low energy buildings. I'm a little concerned right now that some of the solutions, the kind of go-to situation that we're in right now is to throw energy at the problem. But I also think there's an opportunity that if we do this right, that we can actually create buildings that are healthier for people and work better for the environment too. So that's the sweet spot that I think we need to try to get to.
Yeah, absolutely. And we have a couple extra minutes, and so I prepared some backup questions just to kind of keep the momentum going. I don't see any questions coming in through the participants, so if anyone does have any questions, now would be a great time. We can take a moment. But in the meantime, Stacey, when Corey was talking about these kind of historical model courtyards and even kind of the old mid-century motels, I was thinking of kind of some of these historical responses to mix in the past. And I thought maybe we could ask you a little bit about your perspective on that, some historical case studies, and how we can kind of use them to keep informing us.
I think it's been really fascinating in this whole period. There's been this huge resurgence of going back to Florence Nightingale's original findings on creating healthy spaces for treating patients. So it's kind of one of those situations, what's old is new again. When Corey was talking about the outdoor circulation space, it reminded me when we were trying to deal with the Ebola outbreak that had happened. One of the solutions that we did back then, and I'm even seeing come up more often now in planning, is exam spaces that are directly accessible from an exterior walkway, right? So that patients who may have been exposed to whatever that infectious disease is, they never pass through the greater circulation. They're able to go directly into those treatment spaces, and then staff comes from the other side. So I think it's, I like what Robbie said about how sometimes it takes a global event to sort of make the change stick. And I think that's what we're seeing. We're going back, we're seeing what things worked before. And I'm hoping that this time we're really able to sort of carry that momentum forward with the change.
That's so interesting. Well, thank you guys so much. This has been such a fascinating conversation, and I think a really great way to end the series, because as we mentioned at the beginning, while Focus on Health was essentially a chapter within our report, it kind of bleeds throughout everything that we've been researching, because now we are just so acutely aware of our physical and our mental health within interior and exterior spaces. And so we really couldn't have had this conversation without you guys and kind of the wealth of knowledge and experience that you guys have been able to bring to the table. So just round of applause, virtual round of applause. Thank you so much. And for everyone who's listening, we will send out a follow-up email probably I think on Friday or maybe early next week that just has the recorded session. So if you want to recap any pieces in particular, we'll also include the link to Branch Pattern's new flu detector tool, and then we will also provide a link for the COVID best practices report. If you haven't had a chance, it's a great document, lots of collaborative kind of discussion. And so just thank you guys again, and everyone stay healthy. And we'll give you about 5 minutes back of everyone's time.
Thank you.
Thanks, everybody.